Lois is the Director of Patient Safety and Clinical Risk Management at University Hospital. She has her BSN from Rutgers, Newark, and her Doctor of Healthcare Administration from the University of South Carolina. She is a consummate professional, has deep experience in nursing, and has spent the last almost 7 years at University Hospital. And so we're thrilled to have you here, Lois, and would love for your comments and appreciate you joining us today and sharing this time. So I'll kick it to you for the amount of time that you have left. I know that you had a conflict, so
I do.
Thank you.
Thank you so much, Travis. Can you hear me, everyone? Is my audio okay? All right. Thank you so much for just allowing me to be a part of the conversation. I really felt like this was important, and I apologize. Dr. Chris had an emergency, as she said, so I have large shoes to fill, but I'm really happy that this organization has a integration and strategy person at the executive level, because during this pandemic, it was absolutely essential. So I really wanted to spend my time just kind of giving you what our experience was in the hospital. And if I had to say, what are the 3 skills that everybody needed to get through this, it certainly would be adaptability. It would be, my B would be belief in evidence-based medicine, which you'd think that all people working in a hospital would have that perspective, and it's not necessarily the case. And then my C would be communication skills, cognitive skills. And if I had a D, it would be digital skills, because one of the things that we recognized very early on is that there was a lot of moving parts. So I heard other speakers talk about the types of healthcare professionals that will be necessary, and absolutely everybody was needed at the table. So I wanted to talk about our experience and sort of what were the things that we didn't anticipate, but really were fixing the plane while we were flying it. And I think the number one thing, and I want to just give kudos to our CEO, Dr. El Nahal, because we recognized early in the pandemic that there was a need for clear and direct communication. So our CEO actually set up virtual town halls so that on a regular basis, we would have 2 conversations that would happen with leadership at least twice a day, because of everything, the information that was coming out was so rapid, and there needed to be a very clear line of communication, and there needed to be leadership communication to the masses, because everybody was impacted. We have approximately 300-400 patients that are inpatient at any one time. So early in the pandemic, just kind of recognizing that because we are a specialty hospital, we really did not have the option to not provide services. There were hospitals that went on divert. We were always open. So the communication from the beginning and the top was very important. We had COVID-19 information that would come out literally daily. So written, verbal, any multiple methods of ways to communicate with our staff and with our community. We developed internal strategies and trying to make sure, it's so funny, we think that we communicate, and I think there's something that says that the mishap in communication is assuming that it has occurred. So just because we put it out one particular way doesn't mean that that's the way that it was interpreted. So that was a big challenge. The screening and testing that was needed early on was also a big challenge, because we had to prioritize screening at the very early side of the pandemic. And then with the multiple different types of screening mechanisms that were sort of evolving as we were going through it, that became a challenge, both communicating what's needed, trying to make sure that we could expedite safe and high quality patient care with the information that we needed to be able to provide it, so that we could screen patients prior to going to the OR, make sure that our inpatients that are appropriately screened. The other thing that came up sort of in the midst of the pandemic was the need to quickly adapt and participate in experimental treatments and experimental studies. So there were studies that were coming up, and then trying to give the community information on what does that mean, what is informed consent, what does this mean for your participation, how much do we know? And I think we have had this conversation with the community about the need for diverse participation in clinical trials, but when you're sort of in the midst of a global pandemic, that conversation just became more prevalent and more challenging, because there wasn't a really good understanding of what is experimental treatment, how is it going to help me? we recognized, and I heard folks just talk about the types of providers that we need. And we identified very early, because our hospital is very, very well made up by the community. So we represent the community. And because there was such a large community spread, we did lose significant workforce members at different points in the pandemic. And so we identified, and I heard someone speak about the need to be able to quickly onboard new providers or new people to work in the hospital. And we recognized how complex just being able to provide basic, say, nursing care. They had to go through training on the computer. They had to, know our infection prevention, know our safety mechanisms. And so I think if anything has come out of this, just recognizing that we need to simplify and be able to establish competence in an area, especially when it deals with patient safety, in a very expedient way. Being able to recognize that we had different protocols for different areas. So our emergency room teams, or people that would pass through the emergency room, had to have a set of protocols. People that were in outpatient, and at one point in the pandemic, as every hospital, had to suspend outpatient services because all hands were needed on deck. So I think the adaptability, and when we talk about the skills that are really, really going to be necessary in the future, is so critical. We have a neonatal service. So recognizing that even the way that we structure our units and the way that we have some units that are open, and recognizing what are the challenges when you have such a contagious disease, and in managing that. Engineers that are able to identify our mechanical needs so that we have negative pressure rooms, and we managed each level of patient in the appropriate room, but recognizing that even those people who are normally not interfacing with patients needed to have a degree of education and safe practice around infection prevention. So being able to make rooms negative pressure in a very quick and timely way was something that happened literally every day, and being able to flip rooms back and forth as needed. The information that was coming out about pediatrics and how we educate parents, our visitor policies, and trying to make sure that patients were supported in the way they needed to be supported, was so critical in this pandemic. Just looking at best practices when it comes to all areas of patient care delivery, and making sure that we were not creating unintended consequences. So each of our specialty areas were really looking at their protocols and making sure that what we were doing and what we were not able to do was still going to end up providing safe care. We talked about the digital needs, and I can't tell you how many providers that were sort of resisting that for so long really had to become super proficient, and we were able to stand up virtual visits and identify a criteria for what patients we could see virtually and what patients needed to come to the hospital to actually be seen and examined very, very quickly. So I just kudos to our IT team, and even the community's willingness to accept and adapt to that, because some of them had never had a doctor's visit over a cell phone, but we manage a lot of chronic illnesses that would have had worse outcomes if they weren't able to have communication with their physician. So end of life and ethical issues came up, and I think this is a conversation that our community needs to have, because in this pandemic, I mean, it wasn't a conversation that we ever had to have, because we never ran out of resources, but it was something that many families had never had a conversation about what loved ones wanted. So end of life and those kind of issues were forced into the forefront many times. These simple things like postmortem care, when you're managing highly contagious bodies, it was a whole different structure from our normal process. And I know that we're short on time. The staff, the last thing I want to mention is that we recognize that we have staff that are part of the community. So our staff wellness and support initiatives were really paramount. There was a lot of talk about healthcare heroes and everything, but these healthcare heroes were panicked at times and stressed at times, and really have gone through a life-changing situation that they did not anticipate, and didn't really have necessarily all of the mental health skills to deal with, whether it was losing their own loved ones or being able to just, some people have come into healthcare for the money. And then when this came up, they were like, I didn't sign up for this. And we literally had people who just could not manage the severity of the situation. So recognizing that we had to provide for staff wellness, for support resources. We talked about internal communication and how critical it was to making sure that it was bi-directional, that we were hearing from our staff and their concerns, as well as making sure that we gave out messaging that was consistent and needed. And then the last thing is just, the childcare, and recognizing that, we have a high female workforce, and a lot of the issues that were coming up around being at work. A lot of people could work remotely. Healthcare providers can't necessarily work remotely. So there were just a need to look at all of those resources to take care of our own internal team. And yeah, I would definitely want to continue the conversation. I apologize that I have to be a little bit brief because I do have another commitment, but I'm happy to continue the conversation.
Great. Lois, thank you so much for joining and for sharing with us. We will definitely be sure to keep you plugged into our work and look forward to engaging you and Dr. Chris as we move forward.
Excellent.
If